Hey everyone, it's Bella. You know how much I'm all about keeping things real and honest, especially when it comes to our health. STIs are more common than you think and can have serious consequences if untreated, but most are preventable and treatable. We're gonna get real, get informed, and get empowered together. You ready? Let's do this. Let's talk about HPV, or human papillomavirus. Some types of HPV can cause genital warts and certain cancers. HPV spreads through skin-to-skin contact, not just sex. The vaccine protects against the most problematic types. Talk to your doctor about getting vaccinated. Regular pap smears are still important. Next up is chlamydia, another super common STI. The thing about chlamydia is that it often doesn't have any symptoms, especially in the early stages. This means you can have it and not even know it, which is why getting tested regularly is so important. Chlamydia is spread through unprotected sex, and it can cause some not-so-fun issues if it's not treated. No thanks. The good news is chlamydia is easily treated with antibiotics. But here's the catch. You gotta finish the entire course of antibiotics your doctor prescribes, even if you start feeling better before you're done. Gonorrhea, also known as the clap, is another bacterial infection that's spread through unprotected sex. Like chlamydia, it can be totally silent in the early stages, but if you do get symptoms, they might include painful urination, discharge, and pelvic pain. Untreated gonorrhea can lead to some serious health problems, like infertility in both men and women, and it can even increase your risk of getting HIV. But don't freak out. Gonorrhea is also treatable with antibiotics, and remember, practicing safe sex is always the best way to protect yourself. Okay, let's talk about herpes. There are two types of herpes simplex virus, HSV, HSV1, which usually causes oral herpes, also known as cold sores, and HSV2, which typically causes genital herpes. Now here's the thing, you can get both types of herpes through oral sex. Symptoms of herpes can vary, but they often include painful blisters or sores in the genital or oral area. While there's no cure for herpes, there are medications that can help manage outbreaks and reduce the risk of transmission. The most important thing is to talk to your doctor if you think you might have herpes, so you can get the right treatment and support. Syphilis is a bacterial infection that's often called the great imitator because its symptoms can mimic those of other conditions. It's spread through direct contact with a syphilis sore, usually during vaginal, anal, or oral sex. In the early stages, you might notice a painless sore called a chancre, but in later stages, syphilis can cause serious damage to your organs, including your brain, heart, and nervous system. The good news is syphilis is curable with antibiotics, especially if it's caught early. Trichomoniasis, or trich for short, is a common STI caused by a parasite. It's spread through sexual contact and can affect both men and women. Untreated trichomoniasis can increase your risk of other STIs, and it can cause complications during pregnancy. The good news is it's easily treated with a course of antibiotics. HIV, or human immunodeficiency virus, attacks the immune system, making it harder to fight infections. HIV spreads through contact with infected bodily fluids like blood, semen, and breast milk. Effective treatments help people with HIV live long, healthy lives. Antiretroviral therapy, ART, reduces HIV levels, making transmission harder. Consistent condom use is highly effective in preventing HIV. Ask your doctor if PrEP, pre-exposure prophylaxis, is right for you. Hepatitis B and C are viral infections that affect the liver. Hepatitis B is spread through contact with infected blood and bodily fluids, while hepatitis C is primarily spread through contact with infected blood. Both hepatitis B and C can cause liver damage, liver cancer, and liver failure if left untreated. The best way to protect yourself from hepatitis B and C is to practice safe sex, avoid sharing needles, and get tested regularly if you're at risk. Wow, we covered a lot today. It's so important to be informed about STIs and to take charge of your sexual health. Remember, getting tested regularly is key, even if you don't have any symptoms. Ready to take charge of your sexual health? Let me know in the comments which tips you're most interested in applying. And don't be afraid to share this video with your friends. Let's spread awareness and support each other. What's the first step you're going to take to protect yourself from STIs? Let's keep the conversation going in the comments. Stay informed, stay protected, and take charge of your sexual health with these essential tips.